Hello everybody, 'tis I, TheRumpledOne. I guess some of you liked when I shared chapter 1, so I'll keep going and I'll share chapter 2 from the basic disaster life support course that I took by the National Disaster Life Support Foundation and American Medical Association. So let's go on to chapter 2. Public health response to disasters. Okay, this is an overview of the public health principles and practices for the management of communities and populations affected by time-limited disasters. Okay, the public health system, its mission, to promote physical and mental health and prevent disease, injury, and disability. That sums it up nicely. Core functions: prevent epidemics and the spread of disease, protect against environmental hazards, prevent injuries, promote and encourage healthy behaviors and mental health, respond to disasters and assist communities in recovery, ensure the quality and accessibility of health services. So you see, their mission and core functions is pretty big. I mean, that covers a whole lot. And you see, you've got local health agencies, and you've got state health and federal health agencies. You got all these agencies. You've got non-governmental organizations and private governmental organizations. Not only that, you've got global health agencies and organizations. Now, the main concern here is really the public health role in disaster response. So in a disaster, rapid and effective action is needed to save lives, protect health, and stabilize the situation to avoid making it worse. Okay? Now think about that. Stabilizing the situation to avoid making it worse. How many times does that not happen? Now there's something that is alarming, frightening, perhaps scary, something that you may not be aware of, but being forewarned is being forearmed, is the emergency public health powers. This is what public health can do in a disaster. Listen, once a disaster or an emergency situation has been declared, various orders may be issued on the basis of the police power available to the locality. These include enforcing safety and sanitary codes, requiring healthcare professionals to report certain diseases to state authorities, establishing curfews, closing schools and businesses, ordering the evacuations of buildings, streets, neighborhoods, and cities, closing access to buildings, streets, or other public or private areas, imposing travel restrictions, suspending the sale or dispensing of alcoholic beverages, suspending or limiting the sale, dispensing, or transportation of firearms, explosives, or combustibles, authorizing the acquisition or destruction of property, supplies, and materials, issuing orders for the disposal of corpses, implementing medical protocols and procedures to limit the spread of a disease, e.g., mandatory vaccinations, issuing isolation and quarantine orders, issuing guidelines for access to and disclosure of protected health information, and licensing of healthcare professionals. Now, perhaps you might want to rewind and start over and listen to that again and take notes, because do you realize the powers that the public health service can have over you if they declare an emergency? They can come in and tell me you've got to leave. They could burn this place down, bulldoze it over. They could seize my weapons, all under a public health emergency. Were you aware of that? Maybe you were, maybe you weren't. But it should have a chilling effect when you realize the power that they have. Continuing on, they have what's called rapid needs assessment. After a disaster, public health emergency response requires quick access to information about the magnitude of the event, the extent of the population's immediate needs, stability of the healthcare infrastructure, local health response capacity, and the impact on essential services, including potable water supply, sanitation services, food supply, sheltering facilities, and electricity. Performing an rapid needs assessment can obtain objective and reliable information about population needs and capabilities, including the need for specialized emergency relief services. They also have what's called enhanced public health reporting. It says, in a disaster, reporting to healthcare authorities is mandatory to provide information to best serve and protect community health. We also have the incident management, which falls under the National Incident Management System and the Incident Command System, which is something I learned when I took the FEMA Community Emergency Response Team class. Crisis and emergency risk communication says an essential component of any public health system is a robust information and communication system able to disseminate timely, credible, and reliable information before, during, and after a disaster. So once again, communication is critical. Okay, 7 cardinal rules for the practice of risk communication. Once again, listen to this carefully. Accept and involve the public as a legitimate partner. Be planned carefully and evaluated systematically. Be responsive to the specific concerns of the public and correct misinformation. I read that correctly. Correct misinformation. Be honest, frank, and open. Coordinate and collaborate with other credible sources. Meet the needs of the media. Involve clear and compassionate messaging. Now, what this means is that they might not tell you everything that's going on. And they also talk about community evacuation considerations. If is evacuation the best course, or should shelter in place be considered? Where will populations be evacuated to? How will they get there? Who will manage and communicate updates to them while they are temporarily housed? What about companion animals? Many people will not leave without the family pet. Okay, population-based surge management. Large-scale disasters and public health emergencies inherently cause a scarcity of available resources and disproportionately affect populations with functional and access needs, e.g. pregnant women, children, those with chronic disease, the elderly, the disabled, and the dispossessed. So, you say facility or surge-in-place solutions maximize healthcare facility capacity for patients during a disaster. When these resources are exceeded, community-based solutions, including the establishment of off-site hospitals facilities, may be implemented. So you see what happens is remember, disaster is defined as when the need is greater than the resources available. So if we've got more heads than hospital beds, we have a disaster on our hands. Let's see what else we got here in Chapter 2. They talk about communicable disease prevention and control, laboratory services, mass care services, environmental health services. And then they talk about recovery and beyond. It says public health personnel will participate in after-action reviews to evaluate overall response, operations, and identify strategies to enhance the resilience and responsiveness of community health systems and infrastructures. That's a mouthful, isn't it? It sounds good on paper. But you see, they have some discussion points, putting the public health response to disasters into practice. The pre-disaster paradigm, where the pre is planning and practice, resilience, education, and training. And that's about it for Chapter 2. So, once again, if you can take this course, because it was offered free, I highly recommend it. Because as I just noted, there are some things in here that you probably didn't know, and now that you've heard it, it might help you be better prepared. Because if you fail to prepare today, you're preparing to fail tomorrow.